in the past, when we see a patient in the clinic, we see someone with a hearing loss, we focus on hearing loss. But we now know that untreated hearing loss impact on many other aspects like depression and cognitive functions, social isolation and loneliness. So it's really important for hearing healthcare professionals to have a overall understanding of these patients could be at risk for many other factors. So what we did was we conducted a study called Knowledge, Attitude and Practice Survey. So we investigated the knowledge and the attitude and what their current practices are when supporting clients with hearing loss and dementia. We found there's a massive gap between knowledge and the practices. Hearing healthcare professionals knew there's a link between hearing loss and dementia. They knew these patients need more time in the clinic. They need the traditional tests that we do. We can't rely on them. We have to rely on more of objective tests. We need to know about their cognitive functions, all that. But when it comes to practice, hearing healthcare professionals were not confident in asking about cognitive health from patients. They were like, they came to get a hearing test. We're asking about their memory, didn't feel comfortable. They didn't know who to refer, which doctor, what's the referral pathway. And when you're writing a referral letter, they were not comfortable in writing, or this person came for hearing test and now we're asking their memory. So they didn't know the referral pathways, and the clinics that they were working usually did not allow them to have additional time for these patients with cognitive impairment, and they also did not have much training in objective hearing test and objective mapping techniques and things like that. So we found there's a really good knowledge, but the practices were very low. So we have now identified this gap. So our next what we're planning to do next is to create a training program to upskill hearing healthcare professionals so they can support these clients and also create some clinical guidelines. So we've already finished our study in Australia and China. Currently we are collecting data in 9 other countries. So I think this is going to be a global study, and so that we can support these hearing healthcare professionals really well. So in turn, they can support the clients.